On behalf of the Association of Surgeons Nagpur, I welcome all of you, the speaker, chairpersons, participants on this beautiful morning on which we are going to discuss something out of the box for surgery. So I welcome all three chairpersons. I welcome all the participants to this program.
It is my honor and pleasure to welcome Shruti ma'am to today's session. Apart from being a professor at TerrySAS, she's been conducting many trainings, many management development programs for sustainability to different industries.
Thank you so much, Neeti. And thank you so much, Dr. Prachi, for having me here. And thank you so much, all of you, for coming on a Sunday morning to listen about sustainability. Thank you all and for being here. Now, sustainability, if we look at sustainability, the problem of sustainability, it's not very old. Albert Einstein actually quoted that we cannot solve our problems by using the thinking we used when we created them. So the problems which we are facing today, the problems of global warming, the problems of frequent climate events, the problem of population, the problem of inequality, all of these problems are problems which, created by the thinking. This all happened after World War II. So all these problems started happening when industrialization took place. So that's the reason they say that, you cannot solve by using the same thinking. I remember I've studied in my school that air and water is free, rest everything comes with a cost. Now, if you look at the problem of air and water, we have air is polluted. Most of if you look, I mean, all of you are in this fraternity, medical fraternity, air pollution has led to so many diseases. Water we don't have. We're still struggling with clean water to drink. Water is a listed commodity in New York Stock Exchange. So a liter of bottle packaged drinking water is costlier than a bottle of Coca-Cola. So that's the irony we are in. And, that is the context which I'm saying, that we cannot solve our problems with the same thinking. So what kind of a thinking do we need, to address these problems, these ongoing problems which we are dealing with today? So this thinking is known as systems thinking. And systems thinking is a thinking methodology which is used to solve complex problems. And these complex problems are the problems where we don't have a solution to it. If you look at the problem of climate change, there is no set solution to it. We are in climate crisis. We are actually on the edge, but we don't have a solution to it. So what's the way out? And we look at a system which is being sustainable for years, and that system is known as our ecosystem. If you look at our ecosystem, if you look at the Mother Earth, planet Earth, it's been that system which has been sustainable. So we look at the thinking, and the systems thinking approach is the approach we follow in sustainability. And this thinking says that development is what environment and society is where we live in, and development is what we do in order to survive. So whatever we are doing here, if we are running individuals, I'm talking about individuals, communities, organizations, whatever we do, we need to understand that we are part of environment and society. So environment and society is where we live in, and development is what we do in order to survive. So unless and until all what we do is aligned to environment and society, it is not going to be sustainable. I'm sorry, I think somebody is unmuted.
Excuse me, requesting all participants to mute themselves, please.
You can change the slide.
Oh.
Yeah, thank you so much. So, yes. So they say that system thinking is whatever we do, whatever our actions are, unless and until it is allied to the environment and society, it is not going to it's not going to be impactful. And sustainability as a term is very simple. I mean, sustainability means, continuity. If you look at sustainability, it is, it's a philosophy. It talks about maintaining the continuity. So sustainability as a term came in spotlight when our survivability became an issue. When this whole process, when suddenly the industrialization started and we did a lot of development happened. So collective greed led to the global warming. When we look at the global warming, and I'll tell you the climate crisis which is being happening. So global warming means like our temperature. Suddenly there was a lot of carbon in the air. And to understand the basic technicality of how does this carbon lead to global warming, now carbon, in whenever we whenever there is a carbon emission in terms of, we burn coal, or our air conditioner, cars, everything is basically, it enabled everything when you look at energy consumption. So we are burning fossil fuels for energy consumption. These fossil fuels, when they burn, they convert into carbon. It goes in the atmosphere as carbon. Now, carbon, it stays in the atmosphere. And when sunlight falls on the Earth's surface, and when it goes back, when the Earth becomes warm, and infrared radiations, when it goes, the warm objects emit infrared radiation. So when these warm objects of Earth, they emit infrared radiation, carbon captures it. And that capturing of infrared radiation leads to a warming, which is known as a global warming. And it has warmed our planet so much that we are not on the threshold. We have even crossed the threshold. So all these things, when we talk about a climate crisis, where we talk about, frequent climate events, if you look at, if you look around, these are all frequent. If you look at floods, if you look at wildfires, if you look at erratic rainfall pattern, everything is related to climate change. So government has said that IPCC's Intergovernmental Panel for Climate Change, it talks about, in last year it came up with a sixth assessment report. And it said that we have to keep our global temperature, average temperature, at 1.5 degrees centigrade. Last 80 years, the temperature increase has been 1.3 degrees centigrade. Last 80 years onwards. Suddenly from 1950, if you look at 20, the temperature rise has been 1.3. And temperature rise of 1.3, if you see all the crisis which we are facing today, is due to the temperature increase. Climate change per se, we cannot look out of the window and see a climate change, effect due to climate change. But, it's felt very gradually. And you see, if you look at the, we talk about 1.5 degrees, what government has said that we have to keep this temperature till 2100 in order to survive. So survivability has come into question. That is why sustainability became an option, or sustainability became a solution to climate crisis. So sustainability, we have been practicing sustainability. If you look at our Indian mythology, the way we operate, ghar pe jaise resource efficiency, we follow resource efficiency. We don't encourage waste in our households. So we have been practicing sustainability, but sustainability as a solution to climate change became highlighted when our survivability became an issue. We talk about very frequently, we say, save the planet, save the planet. The planet does not need to save itself. The planet will survive. It is a sustainable ecosystem, which I spoke about. The problem is with the survivability of our species, and the problem is so grave. So this is basically a simulation of what you see, 1.5 degrees centigrade. This will be our Earth. If we continue to work the way we are working, all of us collectively, species, I'm talking about collectively global population, we are going to reach 4 degree centigrade by 2100. So we have to limit our temperature to 1.5 degree in order to survive. The recent climate action report suggests that the way we are functioning, people are not aware that how grave the crisis is, that we will reach 1.5 degree by 2030. In 7 years, we are going to reach 1.5 degree. Neeti, can you please change the slide? Now, if you look at climate crisis, and I talk about wildfires, when I talk about wildfire, there was a recent last week, Brooklyn, Canada, mein there was a wildfire in Brooklyn. That whole Brooklyn Bridge was there in smog. Air pollution is due to, it is a cause of air pollution. There, when you look at farmers' suicide, when we talk about Marathwada farmers' suicide, again related big time to climate change. Last year, Pakistan, when you look at from the Pakistan perspective, there were floods, there are hailstorm. If you look at El Nino, is what is the condition when we look at El Nino, the monsoon, the monsoon pattern getting affected. So climate crisis, how do we see climate crisis? There is, we see climate crisis and we see that we are reaching the threshold when we see a lot of very frequent climate change events happening. Neeti, can you please change the slides? So this is a fact from January to April 2023. 84 out of 120 days, and this is purely India. I'm talking about India here. So and this is last initial 4 months. 84 out of 120 days, we have witnessed, India has witnessed extreme climate events. We have, I think last week it was there in newspaper that there has been death due to heat waves. So this is how the situation, when we look at the frequency of climate change, this is how grave it is. Neeti, can you change the slide, please? So India saw natural disasters almost every day in first 6 months of 2023. Let us look at focus on the loss of lives which we have seen. Himachal Pradesh 359, Maharashtra and Assam 301 and 194 human deaths each. So one incident, everything we had Balasoram, and it was very, I mean, that was a very sorry incident, the train accident which happened where so many people were killed. Every government, everybody is looking, it's there in the newspaper, but there's hardly any coverage of the climate deaths if you look at. So last year, 2,244 people in India died only due to climate change events. $159 billion were lost only due to climate change last year, and this is, I'm talking of India 2022. That's how grave the situation is. That's how grave the crisis is. Neeti, can you please change the slide? So when we look at effect of climate change in our day-to-day life, if we think that it is, there are a lot of forums where I go and people say that it's not our problem. But yes, climate change has affected us individually also. So please change the slide, Neeti. So if you look at the sleep patterns, we are sleeping worse. 62% of the people don't sleep well. So mental health, anxiety issues are there in individuals. There are more intense allergies. I'm sure all of you would, second that there are a lot of allergies, intense allergies there. Obviously, the population is rising. If you look at from an Indian perspective, only we are 1.3 billion people, and we 18% of the world's global population. We are 18% of global world's population. We occupy 3.4%, 2.4% of the space of global space. So that's, the population is increasing, cost of housing, increasingly scarce and expensive food. Food inflation has gone on a all-time high. We are losing natural spaces, traffic jams, all of these things, are affecting our day-to-day life. Can you change the slide, Neeti, please? Yeah. When you look at climate change impacts on health, please pay attention. I think this is something which, it actually concerns all of you. And this is not, this was again IPCC, the Intergovernmental Panel for Climate Change last year. They came up with how climate change, what kind of diseases, how it would affect the health and well-being of individuals across the world, and what kind of diseases are going to be because of climate change events, the way climate change. So these are well-researched report which has been submitted by IPCC last year, and it says increased cardiorespiratory morbidity and mortality associated with ground level ozone. That lot of cardiovascular diseases, people will be suffering from there. It can be related to heat waves, it can be due to air pollution, it can be due to a lot of other factors. It says climate plays an important role in seasonal pattern of temporal distribution of malaria, dengue, tick-borne diseases, cholera. Diarrheal diseases would be more when you look at it from a climate change perspective. Vector-borne diseases would be there. So we already have seen dengue is there. In vector-borne. Neeti, can you please change the slide? Yeah. It talks about increased malnutrition and consequent disorders, including those related to child growth and development. Now, climate change has impacted the photosynthesis process on plants. So the soil quality has got affected. Microplastic. When we talk about the biomedical waste, I will let you know that how microplastics have got into soil. If it has got into even those, it has got into the food we eat, and how does it lead to different kind of disorders. So increased malnutrition. I think children, if we see the IQ level of children, when I talk about Delhi NCR as a whole, IQ level of children due to air pollution, it has gone. Children are more suffering from when you look at neurological conditions are there. increase in the number of people suffering from anxiety and mental health issues. So this is the report which is given by IPCC, that this is how climate change impacts on our health. Neeti, can you change the slide, please? No. Now, when we look at healthcare and climate change, I would just like to actually, I have done few changes in the presentation, but I'll talk about it. So, if you look at, I mean, there is about Nagpur in particular, the place where we are in. If you look at Nagpur, now Nagpur, it's saying that the average temperature is going to increase by 1.9 degree centigrade by 2050. Now, which means that heavy rains increase the moisture content of the solid waste, and it impacts the processing efficiency and reduces productivity. So Nagpur as a city, it is going to face two big problems. One is the solid waste management, and second is the sewage. So these are the two. When they assessed, I mean, there is a vulnerability, city vulnerability mapping which we do. So when Nagpur, as such, it said that there is going to be 12.5 to 30% rainfall increase is going to happen in Nagpur due to this extreme climate change event. So this rainfall increase is going to lead to a lot of other vector-borne diseases, which is going to be in Nagpur in next 7 to 8 to 10 years. And the problem which the city is going to face, the urban city is going to face, is two. One is solid waste and second is sewage. So that is how, when you look at, when you look at the problem of climate change, that's how it is. Now, when we look at it from a healthcare perspective, healthcare perspective, the carbon footprint of healthcare. Now, if you look at it from an India perspective, globally, the carbon footprint of healthcare is 5%. Matlab, hospitals, they contribute to 5% of GHG emission. But when we look at it from an Indian perspective, healthcare contributes 8% in the GHG, which is greenhouse gas emissions, or the contribution in the carbon footprint is healthcare is 8%. Now, which is actually a big number. Now, what are the contributors to the healthcare? When we look at it, 15% comes from biomedical waste. So I think Dr. Deshpande spoke about biomedical waste. I will talk about the new rules and regulations of biomedical waste, which CPCB has given. So we'll discuss that. Second is energy usage. So when we look at it from an energy usage perspective, and our when the buildings, our hospitals, our ORs, we have all those sophisticated equipments which are there. So energy usage is huge in healthcare sector. Cooling, air conditioning is a must. So cooling again, is has a lot of carbon footprint. Cooling is also there. Then chemical fumes. Through there are certain three toxic gases which come from the healthcare industry. So chemical fumes, the cooling, the energy usage, the biomedical waste, all of these things are the major contributor of carbon emissions in the healthcare, and they contribute to 8%. If we look at it from a GDP perspective, everything has to be calculated from the GDP perspective. This is 10% of the GDP. So if I'm talking about 8% of carbon emission, means that impact is 10% on the GDP. So that's how the carbon footprint of Indian healthcare sector is. Neeti, can you change the slide? Yeah. So coming back to the most important, the point here is biomedical waste. We'll talk about biomedical waste in today. Now, there are different categories of biomedical waste. I'm sure all of you would be aware of these biomedical waste. And recent EPR, which is Extended Producer Responsibility, government has focused on the problem of biomedical waste and how can we solve the problem of biomedical waste. Now, for us, when we belong to the fraternity, the healthcare fraternity, they need to be aware. They have to be awareness about what are the types of biomedical waste and how can we handle and treat them. So there are infectious waste. So these are materials contaminated by water and body fluids, cultures and stocks of infectious organisms. Patient waste from isolated wards come in infection waste. Pathological waste, this includes tissue, material of human organs, fluids, animal carcass. There are sharp waste like syringes, disposable scalpels, blades comes in sharp waste. The chemical waste where you have materials like heavy metals in devices, solvents in laboratory, detergents are there. There are pharmaceutical waste that are that are unused waste materials that are unused, contaminated, expired drugs, expired vaccines also come in pharmaceutical waste. There are genotoxic waste, which are cytotoxic, carcinogenic, the ones which are used in cancer treatment. Metabolites come in genotoxic waste. You have radioactive waste, products including radioactive diagnostic, therapeutic materials come in radioactive waste. Non-hazardous waste, they are radio materials that are not biological, chemical, or radioactive come in non-hazardous waste. Neeti, can you change the slide, please? Yes. So this is how the new, when you look at the CPCB rule of extended producer responsibility, where it focuses on the waste part, the biomedical waste part. So it has CPCB has categorized these waste, and they've given them some coding, the color coding, and that color coding, and if they have even for some particular kind of waste, they've even given bar coding. This helps. This color coding helps in the waste segregation. So if you look at the non-infected waste, cytotoxic waste, and chemical waste, they've given the black plastic container. Red plastic container is for solid waste, infected dressings and all, pop casts and all. Yellow plastic container is your anatomical waste, placenta, pathology, body parts. That is for the coding which is given is yellow. And there are set rules to how to handle these waste against the color coding, which in EPR in CP, which CBCB has given, and how to handle biomedical waste. Infected plastics, there are blue coding which is given to infected plastic, which is syringes, gloves, and plastic waste. And the sharp objects are given at the white plastic container. So this is color coding which has been given in the recent amendments of the EPR by CPCB, which helps the hospital or the staff in waste segregation. Neeti, can you change the slide, please? Now, if you look at the yellow one, yes, please. So we have seen that there is color coding of black, red, yellow, blue, and white. So these are the 5 color coding with the CPCB has given, and they've given how to use these waste. So if you look at the yellow category, so they have how to be used and how to be disposed. So this is where type of bag or container to use to dispose them, and what are the disposable options. So if you look at it from a human anatomical waste, which is again coded yellow, you have to have a yellow colored chlorinated, non-chlorinated plastic bags. Now, recently they have asked, the CPCB has asked that, for waste collection for the hospitals, non-chlorinated plastic bags have to be used. So chlorinated plastic bags have to be out of the system. So that is mandated by CPCB. So yellow colored non-chlorinated bags. Then how to dispose them. So incineration, or you have to incinerate them, or a methodology known as plasma pyrolysis, or you have to go for a deep burial facility, which for how do you dispose this waste. Chemical waste, if you look at chemical waste, again, yellow coding is there. So yellow colored container or a non-chlorinated plastic bag. Again, incineration is to be there. For chemical liquid waste, you have to dispose it by preheating before mixing with other wastewater. So you have to preheat them. So autoclaving or microwaving. So there are different kinds of tools and techniques which CB has given to how do you treat the yellow waste. If we look at it from, Neeti, can you change the slide? Red waste. If you look at it from the red waste perspective, which is red is contaminated waste. Again, autoclaving, microwaving. For white sharp objects, you have to puncture proof, leak proof, and tamper proof containers can only carry them. Again, dry heat sterilization followed by shedding or mutilation. Blue waste, if you say glassware, metallic body implants, if you look at it, it has to be disposed in cardboard boxes with blue colored marking. Again, disinfection has to be done prior to that by soaking the washed glass waste, sodium through autoclaving and microwaving it. So these are the guidelines which are being given by CPCB in the recent amendments, the 2021 amendments which they have done in EPR, extended producer responsibility, that how do you handle the problem of biomedical waste. Now the problem with us is multifold. As I think Dr. Deshpande said, that they should make it doctor friendly, and they should also consider our perspective here. So and even the new clause, I think Dr. Deshpande has already mentioned the one which has said that they've set the same rules even for a 100-bedded hospital to a small even if there are 2 beds also. So same rules, the rules would be same across. So that is one thing which they have, CPCB has done. And so yes, there are certain challenges, but then awareness is very important. And currently, if you look at most of the hospitals, the ones who dispose these biomedical waste, the awareness level is not there. So if we need to build that awareness, we need to see that these disposal options are available with us. You cannot mix the biomedical waste. Again it goes into our oceans, again it goes into the landfills. So we cannot send them into landfills without not treating them, because it further leads to a lot of problems. So that is why awareness is very important to deal with the biomedical waste. Now, the slides are not there. Yes, Neeti, this is, yeah, sustainability. Yes. So when we look at it, that what can we do? So we've spoken about what sustainability is. We spoke about how grave the climate change crisis is. We have also, I've also spoken about that what is the impact of climate change on health, how grave it is going to be on the health of individual, on the health of community. We will spoke about, the healthcare sector, say, hospitals in general, or about the fraternity, that what is the carbon footprint there, what are the ways to practice. Now what kind of, how can we create a change? Now what all can we do? When you look at it, this is a way biomedical waste has to be segregated there. Now what are the steps we can take to start our journey? So if we have been practicing it in our hospitals, if it is, that is excellent. But suppose this is something new and we have not been practicing it in our hospitals, then what should we do? So there are processes. So again, these processes have been practiced by European Union, and these are some of the best practices which hospitals have implemented across, where, to comply with this norm. So the first thing which comes here is you have to form a green team. So you have to collaborate. You need a collaborative support network. That can involve surgeon, anesthetist, scrub and circulating nurses, maybe residents, maybe clinical engineers, maybe administrative staff. So the first step in this, that one needs to form a green team. So if we have a green team in our hospital, yes. If we don't, then I think the first step is to form a green team in the team. Some team which is responsible, the ones who can move, the practice or this concept of sustainability. So green team, very important. After we have followed the green team, we need to follow pillars of 5R. So when we look at waste management, specifically in healthcare sector. Yes, sir. So when, yeah.
I think you can continue. There's some.
So when we when we look at it from the waste management perspective, we can follow 5Rs, which are reduce, reuse, recycle, think, and research. So if I talk about reducing, so the reducing the adoption of disposable devices, if possible, through careful standardization of operative packs. I mean, we can do that, and trace with the wise adoption of reusable tools when this practice is safe for the patient. So you have to keep the safety of patients, and we can see that how can we reduce the adoption of disposable device, as I mentioned, in the form of in the form of operative packs or trays which are there. Surgeons can exert. You can exert pressure on producers, as I think Dr. Deshpande spoke about, the stakeholders or the producers, because supply chain contributes a lot. in the carbon emission. Supply chain can be one of the biggest enabler if supply chain, which is your producers and manufacturers, can commercialize tools that would be forwarded to a second life. In fact, yesterday, I think Dr. Prachi, while we were discussing, mentioned that how there are some organizations who have been following these, who are doing a life cycle assessment of all the equipments and machineries, and just see that how can they, prolong the life of these equipments, give it a second life, after their use and dismantling. Can be plastic and metal components could be separated, and it can be recycled also. So we can look at all of that. OR personnel can modify the flow of waste production by introducing waste segregation before the patient enters the OR. So that is also one of the practice which we can do. That we can talk about the flow of waste production. Waste segregation. There has to be a proper flow chart or a structure which has to be maintained. The routine sorting of packaging will spare up to 14% or OR waste from being mislabeled or biohazard. If we, before the patient enters OR, if we can segregate, and we can plan our waste segregation. Blue wrapping paper and plastic trays can easily be collected and forwarded, for a second life. Significant cost savings can be derived from this practice, and even some major players in the single-use device market are now, they're paying increasing attention to newer ways of keeping under control the whole life cycle of disposable items. Because circularity, when we look at circularity, government is promoting circularity, closing the loop. So how much can you prolong and maintain, the use of these items in your operative procedures? Surgical societies can, should do more to engage their members and industrial partners. Whatever infusion diffusion of good practices have to be there. So there has to be a shared value which has to be created. So all of us, like this is one of the webinar which is there. So something more of a knowledge sharing session. If someone has implemented some practice in their hospital or something new which they have done which has helped in the waste segregation or helped in some kind of value creation in the hospital, it has to, the knowledge has to be shared. It has to be shared with everybody. So there has to be a network, so right from, there has to be collaborative approaches, there has to be practices, the good practices have to be spoken about. So all of these things would help in, when we look at it, greening our OR, of giving a sustainability in healthcare. So when I look at it, this is, the sustainability. How can you practice sustainability in OR? Solid waste reduction is the first thing which you do in to practice sustainability. Second is green purchasing. So when we talk about green purchasing again is, the producers, the manufacturers which are there. Like how can we as doctors, we can go and tell them, that okay, right from the, what are the components which they're using, are they reusable? So how can we have, like, right from the time, we can help them, we can tell them that this is where, this is the limitations which we have. So the products which they have, it has to be mindful that it should not have any impact. So green purchasing has to be there. Water conservation, very important point in hospital. Water conservation. So be it, STP plants or rainwater harvesting, whatever we can manage in our within our hospital premises, we have to look at water conservation. We have to have a care pathways in place. So care pathways go a long way. I think in OR, care pathways go a long way. Every hospital has implemented care pathways, but while designing, we can be more mindful while designing the care pathways, so that, and right from the patient's perspective, right from the surgeon's perspective, right from the hospital's perspective. And then the last and one of the most important things, there has to be a cultural change and surgical leadership if we want to practice sustainability in OR. There has to be a culture change. This is what will make the impact, or if this will drive a change or create a shared value. When I talk about culture change, I think all of you actually, if you can actually, you can collaborate, you can talk to your people, you can talk to the staff, you can enable this culture of sustainability within your fraternity. So that cultural change has to be there for behavioral change to happen. Behavioral change is not possible without a culture change. So when we look at climate change, it is our problem. It is not government's problem, or it is not every. All of us are getting affected from it. It's not only patients. Our fraternity is getting affected from it. It is not a country's carbon which is impacting it. It is everywhere. It's a global problem. It is the question of our survivability here. So that is why we need to find ways to be more sustainable. We need to find ways to maintain the continuity on, so that collectively all of us can live together. Collectively all of us, everything can create a shared value for a society. So that would be my talk. And thanks for a patient listening.
Very nice talk, Dr. Shruti. Really enjoyed. You have really opened up our eyes, ears, mind. And now I think whenever I enter my OT from tomorrow, I will always think, अरे ये light बंद कर सकते हैं क्या? अरे ये tap बंद कर सकते हैं क्या? Small things. And as you said, the main message which I got is it's our fight. That is the main message which I got.
When you talk about the sustainability, this is a future generation seeking and imploring the present generation, us, to ensure that they leave the planet for their usage subsequently in their hands. It is really an eye-opener. Shruti, I compliment you. Unfortunately, what has happened is what you rightly said. In long back, when we talk about Dr. Deshpande sir will be agreeing, the Indians are genetically tuned to ensure recycling. And we used to be, and in even in smaller nursing homes earlier, long time, you will see the syringes being, glass syringes being recycled. The aprons or anything, everything was being, the linen washed. Unfortunately, down the line, what has happened is we are trying to copy the developed countries and introducing single plastic usage. Even the linen now, they feel that it is a happening thing to have single usage linen across the beds. The single use syringes have come into